Hi, everyone. Thank you for joining us for another in-service topic. Today we're with Karen Rodgers, and she is with Mountainland, our local area agency on aging. Hi, Karen.
Hi.
Okay, so I'm just going to let Karen introduce the topic and then go into our training.
Okay, great. Thanks for having me. So I thought I would start just really quick by telling you what MAG stands for. Let me just share my screen here really quick. We went from Mountainland, let's see, to MAG. So we're still Mountainland, but MAG stands for Mountainland Association of Governments. So that's in case you're wondering. We are the area agency on aging. And so we work with seniors and with caregivers, and we try to provide resources and help them find support and community resources. So I was asked to talk on, no, we're not going to work here. Sorry, hold on a minute. Let's see. There we go. So I was asked to talk on emotional health and well-being in older adults, which is an awesome topic right now because with COVID, this is so relevant. Before COVID, it was so challenging for seniors who were isolated to connect with other people, and now COVID has made this worse, and so we are seeing a higher percentage of depression and more sicknesses in seniors because of this being isolated for so long. So hopefully we're going to go over some things that might help you in your caregiving and the seniors that you come in contact with. So we are going to start with some bad news, but then we're going to start with some great news. So then we're going to go to the great news. So I'm going to start with the bad news first. So we probably already know this, but loneliness kills, and it's actually as powerful as smoking or alcoholism, which is really hard to believe. I hadn't really thought of it that way, but as I started to do some research on this, I found a study that BYU did that found that the effects of isolation and loneliness on seniors was equivalent to smoking 15 cigarettes a day, health-wise. And I'm going to link, or I'm going to send Melissa all of the links to these articles that I'm going to talk about, because this is really important, especially now. So it is a health crisis, not just emotional, but physical. So helping older adults get and stay meaningfully engaged is critical for their health and also for the health of our communities, because think about, seniors make up a significant percentage of our communities, and they have so much to offer, and you all know that because of, you're in this profession, and they have so much to offer. So helping them find and connect to other people is really, really important. Before COVID, our senior centers were places that our seniors could go. They could do activities, they could learn new skills and make friends and have lunch together. But then back in March, we had to close all of our senior centers. And so it's been a real challenge to try to connect with all of these older adults out there. Now, a lot of them are active and getting out somewhat, but it's the ones that are isolated, that are really isolated, that we're concerned about. So that's the bad news. Social isolation is a real serious problem. The good news I found this article. This is so interesting. Good genes are nice, but joy is better. So this is a Harvard study that started in 1938. They studied, it was over 200 Harvard sophomores that they decided they wanted to do a long-term study just to see how they developed, how their careers went over a lot of years. And so it's been over 80 years that they've done this study. And out of the 200 and some odd people who started, or men, because they didn't allow women at that time, it was a male-only school. Out of all of those men, there are still 19 that are alive, and they're in their mid-90s. But this study found some really amazing results, and not what you would think. They found that, let me just scroll my notes here. So what they found was that what makes a difference in how we view our older years is not necessarily our genes or even our wealth, but it is our relationships with people and how happy we are in those relationships with people, whether they're family and friends. It was our connection with people. And so this is a really great find, because we all can't be wealthy, and our health is going to suffer as we get older. But in the next study that I'm going to show you, they found that even with those health challenges, people who stayed connected to other people found their lives to be happier and more fulfilled. And that's something that everyone can do, hopefully. So let me move on to the next slide here. So what another study found was older adults thrive by having a reason to get up in the morning. Everyone needs a purpose and a reason to get up. With us, we're active, we're working, we're going to school, we're taking care of families. We don't even think about, trying to find something to do a lot of times because we're so busy. But this changes a lot for seniors, especially as they get older and start to have health problems. They might have, limitations as far as transportation. A lot of the new technology that's out there, some seniors seem to embrace that. Others are scared of it and won't have anything to do with it. So there are some limitations there. But having a reason to get up, having a purpose, and then making new friends and nurturing old friendships and new friendships, that was something that helped seniors thrive. Finding a hobby or something that they love to do. Not being defined by their limitations. So, in this study, they found that older adults did have more, health challenges. They had, issues that we all deal with or will deal with. But they didn't let those aches and pains define them. They acknowledged them, but they still tried to do the things that they love to do. Acknowledging that aging is hard, is lonely. Most of the participants had lost old friends and relatives, and they noticed when their friends started passing away, and that was really hard. They, a lot of them said they didn't have anyone they could talk to from the old group. And so they did acknowledge that, but that didn't diminish their wanting to still be connected and with other people. Having a daily routine seemed to help too. My grandpa-in-law, he died when he was 97, but he lived in St. George for a lot of years, and his daily routine was every day to get up at 6 and meet his buddies at McDonald's to have a cup of coffee and breakfast. And he did that every day, and then 3 days a week he met them at Chuckarama. And he made sure he did those two things, and then he also went for a walk. But having a daily routine seemed to really help seniors be more optimistic and happy. And then trying new things. The senior centers, again, were a great place for seniors to try new things because they offered classes. I know my mother-in-law loved going to the Orem Friendship Center. She did try some new things. They weren't her cup of tea. She tried some ceramics, and she enjoyed making them. They looked really kind of funny. We couldn't tell what they were, but she tried them, you know. She loved to try new things. And it's so hard now that the senior centers are closed. But hopefully with the vaccines out, they'll be able to open this year. But anyway, okay. So I want to talk to you really quickly about blue zones. I don't know if you've ever heard of blue zones, but they are regions of the world where a higher than usual number of people live much longer than the average. And this term first appeared in the National Geographic in 2005. They found 5 blue zones throughout the world: Japan, Italy, Costa Rica, Greece, and Loma Linda, California. And what they found was these populations lived healthier and longer lives than others in their counterparts. So they studied these, and what they found was what they had in common was their diet, for one thing. They did a Mediterranean diet. And I'll send you the link to this too, because I think this is really fascinating. They had a diet, but they also were driven by life, meaning, and purpose. I'm sorry, let's see here. They said that what they have in common is they couldn't walk outside their door without bumping into someone they knew. So they were very connected to community, and they looked out for each other. They were active in their interests. They also had an attitude that life was positive. They didn't look at aging as or being elderly as worthless, which sometimes in our society we look at our seniors as not being able to do a lot, and so, you know, not being, I hate to say that, not being as of much worth, but sometimes seniors themselves kind of feel that way. But in these groups that they studied, they found that they didn't feel that way at all. They looked forward to the next day. And it was because they connected with other human beings. They had purpose. They wanted to get up in the morning and do things. So it is a really interesting study. I'll just read one of these quotes here. The option to be lonely shaves 8 years off life expectancy here in the United States, but that's not what happens in the blue zone. This is from the National Geographic article, which I'll send the link to Melissa to share. So what are some things that we can do here in our Utah County, in Utah area? Well, before COVID, we had senior centers, which were a really great place for seniors to meet. So they're not open yet. but they still will do still do meals. They're drive-through now, so that seniors have to come and get them, and then they don't have to get out of their car. The meals are handed to them. MAG has a program called Friendly Callers now, and this actually was just featured in a KSL article. It's a program that reaches out to homebound seniors, and they have volunteers who they do background screenings on, and they do a training with, but they basically become a phone buddy, and they call seniors who are lonely. And right now, actually, we have more volunteers than people to call. So if you know of people who could use a phone buddy, at first, a lot of the seniors that are doing it now were like, no, we're not going to do this. But once they got into it, they realized it was just really fun. One lady has her friendly caller call 3 times a week. And as long as it's okay with the volunteer, that's great. She really, our seniors just really need to talk, especially being with COVID now where they're so isolated. And so this is a way that they can talk without, coming in personal contact. As I mentioned, Meals on Wheels at the senior centers, but also, the congregate meals at the senior centers, but also Meals on Wheels. This used to be a great way. The volunteers would actually be able to chat with, or sometimes go in, they would bring the meal in and chat with the person receiving the meal. Now they're not allowed to, but they still make contact with them. They have to stand, 6 feet back. They hang the meal on the door. So we're trying to take precautions, but it's our Meals on Wheels numbers have almost doubled since COVID. But that's good. We're reaching a lot of people. This one picture is, in March, they do a March for Meals, which is the elected officials in the cities go out and actually deliver meals to their constituents. And this is the mayor of Orem delivering a meal to one of his constituents. So it is a great way to at least make some contact with people who are homebound. The Senior Companion Program is run through the county, and they had gone into lockdown where they weren't sending seniors out for a long time. They have started up again. So if you are, I'll again send this information over if you're interested in finding a senior companion for someone that you know, if they are homebound, that would be great. Jewish Family Services has a number of online programs specifically for people with dementia or chronic illness and their care partners, but that they can do together. And also Salt Lake City has a virtual senior center, which they have said that they'll let other people join. But if you want to do the activities that you need materials for the crafts, then you'd need to go up to Salt Lake City to pick them up. But there are other things on their virtual senior center that you can do that you don't need materials for. But that is another way to help seniors feel more connected, and that would be on Salt Lake City Aging website. Let's see. So, we have we do a lot of caregiver support. So we have 2 virtual support groups that we do during the week. We have a dealing with dementia class, a stress busters class, and music and memory. I'll send more information over But basically, that is what we do. I'd say if you have any questions, but you can't ask me, so I will leave it at that.
Thank
So,
you, Karen. I think that that's good information for all of us anyway this past year and ongoing as we know it, but especially for our senior community. And all of those programs are excellent ways for our caregivers to get involved with our senior community more, help them interact more. A lot of seniors may not even know about these options. So it's an excellent opportunity to learn more about these. And I'm so grateful that you were able to share this with us. I will link the articles and any information that Karen sends over in the description box below. And we're so grateful that you guys could check out our in-service. Thanks for joining us.